Okay, we're looking at endocrine pathologies. So we talked about the endocrine system and how hormones are used to really communicate to different organs of the body to either upregulate or downregulate its function. So pathologies are going to be anything that is going to excessively turn up the speed or turn down the speed of some sort of pathway or production from the individual glands or organs, right? So it triggers something to speed up, and then that talks to something else to speed up, and then you have this chain reaction of conditions, and then you have cellular dysfunction on the back end because of the upregulation or downregulation that is excessive in that particular area. So different diseases are going to be of the pituitary gland, right? So the pituitary gland, you have the anterior and the posterior pituitary gland. In the anterior, you're gonna have all of these different hormones, these chemical modulators, right? So an easy way to remember these is the acronym FLAT PEG. Okay, so that's going to go through all of them, but you have different trophic hormones. So these hormones are going to get released and going to go down to the adrenal cortex and then stimulate the adrenal cortex to secrete its own hormones. So it's like passing the baton on the track and field racetrack, right? You're sending information to the next person to then send more information to the next person, and so forth. What we're looking at right now is growth hormone. So this is going to stimulate muscle and bone growth. It's going to help maintain and repair muscle and bone as it breaks down. So breaking down, rebuilding, that whole thing, like maintaining a castle or a highway. We have these different diseases or conditions that are caused by either a excessive production of growth hormone or not enough production of this hormone. Gigantism, Andre the Giant. It's freaking huge, right? So as a child, his pituitary gland secreted too much growth hormone, and this hormone caused him to grow excessively through childhood. So, the more time you have to grow, the bigger you're going to get, right? So this is usually from a tumor in the gland, causing it to not function normally, right? So there's a excessive overproduction of this hormone or upregulation of this hormone. Then you have acromegaly, which is too much growth hormone during adulthood. So this person's not going to be, a giant, but they're going to have really prominent features, right? So you can see how his jawline is very prominent. His ears and his hands and feet might be very prominent. So this is just going to increase the growth of the size. So Tony Robbins has this condition. So you see how he's really tall, but he has just kind of these very chiseled, broad features. Then we have dwarfism. So this is going to be a underproduction or downregulation of the growth hormone, but this is going to be due to many different factors, right? So the defined height is going to be 4 feet 10 inches or smaller or less, and the average height of dwarfism is 4 feet. So there's measurements, but the way you get to this and how this happens from many different things, environmental factors, genetic mutations, deficiencies with, growth in the womb. Sometimes there's malnutrition or different conditions that are happening from the parent that kind of like translates down into the womb. And so there's so many different varieties of ways how this person is born, and then they don't grow to a quote unquote normal size, or a average size. Yeah, there's many different reasons. One of the most common conditions is achondroplasia. So wee man here, he has a normal torso, right, and head, but then his arms and legs are shorter than normal, right? So it's there are many different conditions where you can see this person here has really short arms compared to her arms are much longer, but these are more uncommon than this condition here where they're just a shorter, regular person. Okay, now diabetes insipidus. So not mellitus, but insipidus. This is an uncommon disorder, but if somebody has some sort of trauma to the brain, then it's going to lead to malfunction of this pituitary gland, causing the kidneys to secrete more urine than normal. So this person's gonna be super thirsty and peeing a lot. Right? So different than diabetes mellitus involving the pancreas. So what does this mean for you in clinic? If a person is constantly urinating, then they're going to be at risk of dehydration. So making sure that they are very hydrated before and after the session. They might have to get up throughout the session and go to the bathroom, but making sure that they have adequate amounts of water, because you are stimulating their metabolism, and it's going to cause them to release more, or their functions are going to release more water, right? So their kidneys are going to produce excess fluid. So you want to make sure that they don't get dehydrated, right? Encouraging them afterwards to drink more water as well. Avoiding stress on the kidneys, so not doing deep tissue around the lower abdomen, right, or the back. So being cautious about the kidneys. Make sure that they're comfortable. You don't want them to be sweating too much, because again, that's going to cause them to be more dehydrated. All right, not using too much heat. A lot of hot towels and hot stones. You don't want to use those. But also looking out for if they're dizzy, dry mouth, if they're lethargic, they might have gone out for some cocktail before they came here, or it's a hot summer day, it's 100 degrees. Looking out for these signs of this person going to pass out, right? So you don't want a person to pass out and fall off your table. So avoiding techniques that are going to cause more stimulation of urine production. Right. You don't want to increase too much fluid movement. Of course, making sure they're comfortable. If they're uncomfortable and they're in some contorted position, it can put pressure on their bladder, and they might have to pee even more frequently, and they're not going to be relaxed, right? Because they're going to feel like they're going to have to pee their pants. So that's not good. If they have any sort of swelling or edema in the lower extremities, then raising it up on a pillow or an extra bolster to help with the fluid retainment in the ankles and feet, right? Of course, afterwards, encouraging them to drink water, but also trying to get some electrolytes in their body as well to help rebalance that. And just kind of encourage them to have regular hydration, especially if it's a hot summer day or that time of year, it's really easy to not drink properly or not drink enough water. They might be soda drinkers or Gatorade drinkers, but not drink enough of actual water, right? So it's something that you can really kind of try and hold them accountable to each time and encourage them to drink more fluids. It makes your job much easier if their tissues are hydrated, because that's your job, is to create more of that hyaluronin, more fluid motion between the fascia to help the tissues mobilize, right? That's the goal, fluid movement. Having them do light activities after a session, avoiding heavy exercise after a session. You're already circulating more fluid through their body. They're going to have increased fluid loss. So you don't want them to go out and do some, HIIT training and sweat even more, especially when it's hot out. Okay. And of course, having them be aware of dizziness, dry mouth, headache, depending on how long they've had this condition. If they've had it for a while, they're going to know what to do and how to mitigate. It's for those who this is a new condition for them and they're not really sure what to look for other than what their physician told them. But that might be, a month ago and they forgot some of the things. So she's kind of encouraging them by looking at their signs and symptoms. Now we're looking at the thyroid. Okay. Again, we have a thyroid excessive upregulation or downregulation, too much or too little. So these are the mnemonic for the 7 B's, which are the main functions of the thyroid hormone. So the main thing is metabolism. Just think metabolism, how your body takes in nutrients, breaks them down, and uses what it breaks down. Fats, sugars, carbohydrates, all this stuff, bone growth, and just like the entire function of what goes on in your body on a cellular level. That is kind of your metabolism. Energy, usage, output, and storage. Okay, so you have your basal metabolic rate, right? This is the speed at which your body uses energy. So you have kind of like a baseline at rest. You don't want it to go too low. You don't want it to go too high, right? So this energy level is going to have you burn calories. It's going to help you breathe. It's going to help your heart beat properly. If it goes too high, then you have tachycardia or like bradycardia if it goes too low. So you want to have your metabolism, your energy usage moderate, right? Just like your cell phone. If your battery dies too quickly, you don't want it, right? So blood sugar, you need a good amount of sugar in your blood, but not too much. Sugar, it turns into energy. So it's an energy source. So you want your body to maintain a good amount of energy between meals, right? The thyroid is going to break down fats in your body, right? So using the fatty acids, it's going to, the thyroid is really good, really necessary for brain development. Your brain really needs fats too, right? And sugars. So your brain needs energy. So your brain needs all of this stuff, and this thyroid really controls the brain function. So when there's a problem here, there's a big problem with cognition as well. All right. So these are some other things: helping pump the heart, helping keep babies' lungs open to breathe better. Very important for this to function. So if there's a problem with this, right, and there's excessive inflammation or growth, then you're going to have a large cellular area. It's going to push on your Adam's apple or on your throat, trachea. It's going to be uncomfortable, right? So you're not going to want that to be swollen there. So if that's uncomfortable and it's swelling and it's causing this large mass on your throat, then of course in clinic you want to avoid direct pressure on that area. So focus on the shoulders, upper back, and neck, sides of neck, because in that area, if it's uncomfortable, the person is going to be clenching and tightening their shoulders, lifting their shoulders up. So all of the soft tissue around that area is going to be tight. Okay, being gentle around the throat, right? They can be very sensitive on there. So no deep tissue work there. Making sure they're comfortable, obviously. Avoiding them prone too long, putting pressure on the neck, and then avoiding heat, right? So there's already swelling, so we don't want to exacerbate this swelling and put heat around or on the neck. Okay, so Graves' disease, again, overproduction of thyroid hormones. This again, because of the metabolism, is going to cause anxiety. It's going to raise the heart rate, right? So this person is going to be kind of hypervigilant a little bit. This comes from genetic predisposition, happens in your genes, or upregulation or downregulation. I hate to stick to this fixed term of your genetics, because it's like a light switch that's a dimmer switch. It can be turned up or turned down, right? So it's gradual. So if we have the proper conditions in our environment, then we can keep these triggers off, these genetic switches off, and then our body won't have tumors and conditions and these diseases, right? So disease is, everybody is not in ease, it is in dis-ease. So again, if you smoke, it increases that dimmer switch of you getting this condition, right? If you're super stressed out because you don't have you have depression or anxiety, but it's not controlled, right? It's like we're not getting help to help our stress levels, then it can get out of control, and again, increase the chances of you getting this disease. So when the cells cannot communicate with each other in the thyroid, then you have miscommunication. When you have miscommunication, then the immune system can attack cells that are good for the body and mistakenly identify them as potential threats, right? So we need to have all the walkie-talkies talking on the battlefield to make sure who's on our team and who's the enemy. Okay, so this is just getting kind of deep into the whole of, we have these antibodies that bind to the thyroid stimulating hormones, and you see all these receptors here. And the more that these bind, the more of these hormones come out, and then you have an overproduction of T3 and T4, right? Just the levels of numbers of iodine attached. So it's just, you're going to have too much of this. And then again, if you have too much signaling, it's going to signal a upregulation of different things in the body to turn on too much. Then you're going to have these thyroid enlargement because of this overproduction, right? You're making too many things, so these are backing up in the warehouse. This is going to cause acceleration of their metabolism, increased weight loss. They're going to be increased appetite, heat intolerance, right? And sweating. So they might get very dehydrated very quickly. They're going to have increased heart rate, right? High blood pressure, heart murmurs, palpitations. So when they come in, they might not easily be able to relax on the table because of this condition, right? And then you're going to notice the puffing around the eyes is a sign of Graves' disease. So bulging of the eyes because of those tissues. And then occasionally they're going to have thickening and redness of the skin, but it's typically on the front of the tibia, right, on the shin. So what does this mean for you in clinic? Again, avoiding pressure on the neck, being gentle around that area. You might have to do shorter sessions though, because if a person is very fatigued, they might not last a full hour, right? So you might have to do 30, 45 minutes. You have to kind of work with them and check in with them to see if they're able to, be on the table that long. Of course, if they have an intolerance to heat, not using hot towels, not using any sort of heat therapies, and avoiding very stimulating techniques because they're going to have, more of a higher blood pressure, right? And then they might have tachycardia happening. So if we don't want to stimulate them too much and increase that output. Making sure that they're comfortable around their neck and throat, and then just monitoring them for discomfort. Like I said, they might only be able to lay there for 30, 45 minutes, but if they have booked an hour, they might feel that they have to sit there for an hour, right? But if you notice that they're very uncomfortable, checking with them, and you might have to stop it early, okay? Or if you know that they have this condition, you might offer a 30-minute session and kind of go from there. So primary goal is to help them relax, right? Down regulating their nervous system, putting them more into that parasympathetic state, right? Comfortable music, maybe using some essential oils in the air, lighting, all this stuff, getting them to be in a more of a calm, less reactive state. Hashimoto's, chronic inflammation of the thyroid gland from an underactive thyroid, right? So a down regulation is not doing enough. Again, genetic factors, environmental factors, if you're exposed to any sort of radiation, right? Stress. Stress is a major killer. Chronic, uncontrolled stress, right? So chronic inflammation, the lymphocytes, white blood cells, or your immune system, they're going to come in and they're going to destroy your thyroid cells, and then they can actually trigger the cells to kill themselves, right? So you need these cells for proper metabolism and brain function and heart function. So again, chronic inflammation can lead to the enlargement of the thyroid. Okay, this is going to slow down metabolism. So you're going to have weight gain because you can't burn the fat off. You can't burn the energy. You're going to be fatigued a lot. You're going to have cold intolerance, right? And you're going to have a slower heart rate, more of that bradycardia. Depression, memory problems. You can't concentrate. Dry skin, hair loss, muscle weakness, constipation, right? So your body is not producing enough. So it's going to have these issues. It's going to slow it down, right? Waste is backing up in your stomach, and it's a slower absorption, reabsorption. So you're going to have more compact food. Your muscles aren't getting the sugars and energy it needs, oxygen it needs to rebuild itself and have strength. So you're going to have muscle weakness. So the person is going to be but more fragile than somebody else that has hyperthyroidism, right? So if somebody has joint stiffness, joint pain, being aware of deep pressure, again, avoiding the neck, shorter sessions, having a warm environment, right? They can get cold very easily, so just having a blanket in there, maybe an extra blanket over their feet. Of course, some heated blankets underneath the table. Hydration, so using a emollient that is very hydrating, so avoiding using an oil, but using more of a cream base is going to be good. Making sure that they are, hydrating before the session. Again, calming them down, watching for pressure, watching for discomfort. Okay. Thyroid cancer. So now we have, it's going from an excessive underproduction or overproduction, so the cells aren't communicating. Now we get to a point where the cells think that that the body is dying, so then it starts to kind of pillage or raid other cells, right? So then we get these tumors evolved here, like the body's trying to survive, and it's just a miscommunication, right? So again, there's going to be more soreness, more irritation, depending on the treatment. There's going to be complications with radiation if they get radiation or medications. So just really avoiding that area of the neck. Okay. Now we go to the parathyroid glands. So we have the thyroid, then we have the parathyroid glands on top of the thyroid. So these glands are going to work with calcium. The thyroid works with metabolism. The parathyroid glands work with calcium. So calcium regulation in the body, in the blood. So we have two main types. Again, upregulation, hyperparathyroidism, and underregulation, hypoparathyroidism, or downregulation, excessive up and down regulation. Hyper, we have primary, overproduction of the parathyroid hormone, okay, because of the enlarged glands, and that's going to increase the levels of calcium that the body takes from the bones to put into the blood. So think of the 7 dwarves going to the cave and with their pickaxes, and they're told to go pick and get some sort of mineral diamonds or rubies from the walls of the stones of the caves, right? And then they're going to throw those diamonds into the pool, right? But we want to be able to swim in the pool and then look at the bottom and look at the nice shiny things. So if the body pulls too little calcium, then we don't have the nice shiny bottom floor. But if they keep taking the diamonds and rubies and throwing them in the pool and fill the pool up, then there's not enough water in place to swim. So we need to have a nice regulation and balance, right? So this is going to be the upregulation of there's too many joules in the pool and we can't swim in the pool. So if you have too much calcium in the blood, then the kidneys are trying to filter out all of these stones, right? I mean, like all of these minerals, and they compact into crystals and then create kidney stones. If you take too much calcium from the bones become porous, and then that cave can actually collapse in on the 7 dwarves, right? Or somebody can fall and crush their hip, a giant bone that shouldn't be breaking. You have excessive urination because your kidneys are trying to filter out all of this excess. Abdominal pain, weakness, depression, fatigue. Your body is working so hard, your kidneys are working so hard to do their job that eventually there's inflammation and swelling, and eventually it'll just stop working. They need dialysis, like the whole thing. Not fun. Then we have secondary hyperparathyroidism, right? So this is going to be the chronic stage. This continues to happen. And then you get chronic kidney disease because the kidney cannot keep up with its production. Okay, then if it can't do its job and you can't produce vitamin D, then you're going to have lower calcium levels, and then it's just going to cause all these symptoms, deformities, because the bones can't get what they need to rebuild properly, right? Then we have tertiary hyperparathyroidism, or third. Tertiary just means third. And this is going to, when this condition just becomes autonomous, like it just keeps running and running and running and running, and then your body is just constantly leading to an excess and then a decline, and it's just like it's going to lead to really bad complications, right? So your body's just going to like shut down if the factory keeps running and running and running without the machines being clean, without the machines being unplugged and maintenance. It's not good. So in clinic, if somebody has this condition, then they are at risk for fractures. So again, avoiding deep pressure. You don't want to press on the spine or hips or ribs. Really the hips are the first place that the body is going to pull calcium, because it wants to pull it from the larger bones first, and then if it depletes that, then it's going to go to other places. So just if somebody's fragile, just not being gentle on them. Again, because of their lower levels and they fatigue, you might have to do a shorter session. Don't overheat them. They're very sensitive to that. And just ensuring the massage room is cool. And again, no hot stones, hot packs, any heat. So hypo, down regulation, underproduction. This is usually from damage, or if the parathyroid glands are removed, then obviously they can't do their job to regulate the calcium. So the calcium can't be released from bones. And then if it can't be released, then you're not going to have enough calcium to then be reabsorbed into the kidneys and then into the bloodstream, and your body can't cycle enough calcium. So then you're going to lead to muscle cramps, because calcium is a mineral that needs to be used for muscle contraction and communication to the muscle. So then there's going to be spasming and twitching, tingling in the fingers and lips, right? So nerve conduction, fatigue, and seizures. Like your brain is not firing properly. So calcium is a big mineral that's needed in the body for proper function. Then you have autoimmune. Your body's, again, not communicating to itself, and it's destructing these glands, thinking that they are harmful or noxious, but they're not. Well, some might be, but others aren't the good ones. So it's destroying more than it needs to. And then congenital means from the genitalia, like from from birth. You're going to have this condition from mutations in the womb as you're developing. And you might have underdeveloped, or you might have no parathyroid glands when you're born, right? So then you need medication. There's ways to deal with that. Now going down to the adrenal cortex on top of the kidneys, so the little pyramids on top of the kidneys, we're looking at Cushing disease. So remember, the kidneys in a stress state, they're going to release a chemical called cortisol. Remember, we have adrenaline, cortisol. So adrenocorticotropic hormone, adreno, right? Cortisol, or the core, or the cortex, right? So adrenal cortex, adreno referring to adrenals, cortical, referring to cortex, and trophic, meaning stimulation or like production of. So it's helping or promoting, if you will, the adrenal cortex to produce its hormones and do its job. So symptoms you're going to have: fatigue, muscle weakness. They're going to be irritable. They're going to have brain fog, right? High blood pressure, headaches. Common thing you're going to see is weight gain, thin legs, and then a fatty neck, right? This is very common. It looks very unproportional when you see that person, but it's a very obvious sign. So again, if somebody has high blood pressure, you're not going to do deep pressure. You want to have them calm. If they're depressed, anxious, or irritable, they're going to be in this fight or flight state. We want to bring them back down to this parasympathetic state. If they have muscle weakness, we want to be gentle with them, right? We don't want to be doing deep tissue, elbows, and all this stuff, right? So then we have diabetes. We're looking at the pancreas. Diabetes type 1, diabetes type 2, and then gestational diabetes just means that this is happening in birth. Sometimes it'll happen in birth, but once the baby is born, then this condition ceases. So diabetes mellitus, not insipidus, mellitus, is the pancreas has a problem producing insulin, and glucose gets too high. Too much glucose gets into the bloodstream and not pulling into the cell. So insulin is the key, like the usher at a not an usher, but an usher at a church is going to put you in your seat, right? You're going to have somebody at a hotel direct you with your bags to your room, right? So they have a key to open your room to put you in the room. But if we don't have enough insulin, then we're going to have too much sugar in the bloodstream, and that is going to be inflammatory, and it's going to cause condition, right? So people with type 1 diabetes, their pancreas is not working properly, and they don't produce enough insulin. Sometimes this happens at birth. Sometimes this happens at puberty, right? So this can be a defect or a underproduction of the pancreas. But then type 2 is you earn type 2 from lifestyle, right? So having a poor lifestyle, eating too much sugar, not taking care of yourself, your pancreas works so hard, just like your kidneys before, it works so hard that it says, you know what, I can't do this anymore, I'm too taxed, so it doesn't respond to insulin. So then you have to actually take insulin injections, right? And you have to check your blood sugar. If it's too high, there's a problem. If it's too low, there's a problem. So our blood sugar, like everything else in our body, has to be regulated. So in clinic, when you have somebody with diabetes, both type 1 and type 2, like I said, the glucose levels fluctuate. So if somebody goes into hypoglycemia, they're going to need some sort of sugar. So a lot of times you can have honey packets, or you can have glucose tablets around in case somebody goes into that state. They're going to get clammy and sweaty, and like you're going to know if they're losing too much sugar in their body. If somebody is injecting type 1, they're going to inject insulin, usually in 2 different spots, like in the thigh area is common. You know that they're going to have injection points, and you're going to see little dots. You don't want to rub over that area because you don't want to push more of the insulin into the system. It's got to titrate into the system, right? So a person is going to usually know how much insulin to inject. That is going to be absorbed, kind of titrate into the bloodstream, and the body is going to use it as it's needed. If you inject too much, right, or if you rub over it and it pushes too much of the insulin in the body, then you can cause the person to be dysregulated, right? Because it's not titrating slowly, and that is a problem. So avoiding any sort of injection sites. And then obviously avoiding any sort of insulin pumps. Again, that pump is going to be pumping insulin into the body. You don't want to stimulate more of the insulin into the body that is not ready to go into it. If somebody has diabetes, they're going to have reduced sensation. Remember I said sugar is inflammatory in the bloodstream. It's going to affect the nerve endings. It's going to cause some damage, so the person is going to be less sensitive. So you're going to be able to go deeper with pressure before they say, yes, that's the right pressure. But if you go too deep, you can bruise them and hurt them. So you have to just really avoid very deep pressure on that person. Even if they say, give it to me hard, you need to say, I understand this, but because of your condition, we're going to start with a more moderate pressure and go from there. I'm going to watch your body and see how it does, right? So we don't want to end up bruising somebody, busting capillaries. That's not what we want to do. But they won't feel it, until afterwards they see a purple blue mark. Avoiding using hot stones or hot packs directly on their skin. Because of this reduced sensation, they can't feel if something is hot, right? They're going to feel the temperature, but they might not feel if it's going to burn them. So we don't want to take off a hot stone or a hot pack or something, and it actually burns their skin because they couldn't be aware enough to be aware and complain or say, hey, this is too hot, let me take it off. So any sort of reduced sensation, you want to be careful with heat and with pressure. Okay. And lastly, any sort of patches, dermal patches with nicotine, with HRT, so like hormones for somebody with menopause. Sometimes it's not an injection, but it's a patch that is heat activated, that it's going to release hormones into the body. So do not go over that patch, because again, you're going to release more of the hormones into the body, causing this imbalance. Okay, so those are common issues that you're going to see with the endocrine system in clinic, and you see a pattern there of what to do with each condition. So it's very good to understand what to do for each condition versus just general contraindications. So when somebody comes in on their medical chart, they say, I have this condition. You said, I know how to what the contraindications are, and I know how to accommodate you in this session, right? So that's the biggest thing, of knowing the contraindications, what to avoid, and knowing what you can do to make a proper treatment plan.